There is a risk that some infections may be transmitted during first aid activities. Certain bloodborne viruses such as hepatitis B and C and the human immunodeficiency virus, HIV, cause the greatest concerns. However, other infections may also be transmitted.
Thanks, Frank. Thanks.
Try to avoid contact with blood and other bodily fluids by using protective devices such as disposable gloves, resuscitation barriers, eye protection and plastic bags. Be careful of broken glass or other sharp objects when kneeling to assist a casualty. Reduce the risks of infection by being immunised against disease where possible, and be clear in understanding your workplace policy on infection control procedures. Medical attention should be sought if there are any concerns following exposure to bodily fluids or puncture wounds, such as needle stick injury.
There's some pressure on here, Mel.
Hand washing and drying is the most important hygiene measure in preventing spread of infection in any setting. A mild liquid hand wash should be used for routine hand washing and emergency first aid situations. Skin disinfectants, formulated for use without water, may also be used. Standard precautions apply for managing blood and body substance spills. Spots and spills should be removed as soon as practical before the area is thoroughly cleaned. Spill kits may be used for cleaning but are optional. When cleaning spills, always wear personal protective equipment such as disposable gloves, eye protection and protective clothing. Isolate the area and ensure you have the correct cleaning equipment. In managing a large spill, greater than 10 centimetres in diameter, cover the entire spill with granular disinfectant or clumping agent and leave for 3 to 10 minutes, depending on the labelling instructions. Granular disinfectants or clumping agents help soak up, solidify and confine hazardous material. Use disposable scrapers to collect waste and then wipe area with absorbent material to remove any remaining matter. Place all contaminated material, including gloves, into a plastic bag and seal. Wash hands thoroughly and mop the area with detergent and water. Where spills are less than 10 centimetres in diameter, the procedure is the same, except there is no need to use a granular disinfectant or clumping agent. A safe method for syringe disposal is to find a rigid walled container, for example a glass or plastic jar or drink bottle with a lid. Gloves can be worn but are not always necessary or available. Take the container to the syringe and carefully pick it up by the fat end. Drop the syringe into the container, pointy end first, and seal with a lid. Never attempt to bend or remove the needle from the syringe. Contact the local council or health service for collection and disposal information.